do.
The FDA will also need to sign off on the plan. Boosters would likely be needed 8 months after people got their second dose of the Pfizer or Moderna vaccines. Pardon me, for many older adults and frontline workers, that time is now. CBS 4's Dylan Thomas live on that story from Loveland tonight. And Dylan, you were assured today that Colorado does have enough supply of the vaccine to offer up the boosters.
Jim, experts tell me that the availability of those booster shots will not be an issue if and when the FDA deems them necessary for the public. But for now, doctors say regularly healthy people should not lie their way in to getting a third dose like those who are immunocompromised. For those with weakened immune systems, this isn't a luxury. This is a necessity.
I have absolutely received my COVID vaccine, the first, the second, and I just got number 3.
Betsy Craig is one of the few who already received their third dose of the COVID-19 vaccine.
I called the third dose liquid gold a little while ago because to me it is. It is the closest thing to protection that will keep me breathing.
Betsy is immunocompromised, diagnosed with scleroderma in 2005. She was given only 18 months to survive. Thanks to a stem cell transplant, she is now thriving, but a weakened immune system still doesn't mix well with COVID-19.
Primary series that we currently do of 2 doses doesn't work well enough.
Dr. Thomas Campbell, UC Health's chief clinical research officer, says a third dose for the immunocompromised is different than a booster shot for regularly healthy people.
Those individuals never achieve adequate immunity with just 2 doses, and they need a third dose just to get to adequate immunity. That's in contrast to people who are otherwise healthy, but we know from emerging data, sometimes the protection wanes over time. This doesn't mean that the vaccine doesn't work. It just means that it can work better.
For Betsy, getting further protection was an easy choice.
It's just relief that, okay, maybe I'm not going to die if I get sick.
If and when the FDA actually approves those booster shots, those with UC Health say that you can get them from any provider. You don't necessarily have to go back to the original place where you got your first 2 vaccines. While the FDA recommends getting the same type of vaccine that you got the first 2 times, experts also say that if absolutely necessary, you can mix Moderna with Pfizer. Reporting live in Loveland, Dylan Thomas covering Colorado First.
Good info.